Contamos también con la presencia del Dr. Jack Miller, expresidente de la Academia Canadiense de Terapia Física Manipulativa. El Dr. Miller es instructor del renombrado método Mulligan, después de haberse formado bajo la dirección personal del mismísimo Brian Mulligan en Nueva Zelanda durante los comienzos del desarrollo de este abordaje. Escuchemos su descripción de la evolución de esta técnica y su opinión respecto del futuro de nuestra profesión a nivel mundial.
Well, I think, the evolution, Bill, has really been from one of just, clinical observation of an individual in a small little physiotherapy practice in New Zealand, seeing that patients can respond to certain types of intervention, not really understanding necessarily the background behind that, but certainly seeing good efficacy and results to their patient. It's moved from there into, again, a wider dissemination of that with more individuals practicing that technique and, again, seeing good outcomes. Then moving from that onto individual case studies, case series, single-blind trials, and right up now to full double-blind randomized control trial studies with large groups of individuals published in well-respected peer-reviewed journals. And so I think we're really moving from the shop floor observation of outcomes into, again, refinement of those techniques, and then into now the investigation of whether or not it is truly effective, which again is well supported. I think the next great leap forward that we're now still just really only scratching the surface is trying to understand some more of the why. Why is it that these particular interventions seem to give us such significant benefit for our patients at a functional outcome level? There's obviously a lot of work to be done in that area still, but that's the next frontier, so to speak.
I see. And how is it that this concept is differentiated from others in terms of clinical reasoning?
Well, I think, first of all, that all concepts in manual therapy are built on each other. There's nothing new, of course, in this universe. Everything is recycled and brought back out and made new again with various changes. I think, to me, the clinical reasoning portion that differentiates out the mobilization with movement is not the abandonment of the pathoanatomical model of musculoskeletal dysfunction, but rather understanding that the pathoanatomical model helps us to understand perhaps more what not to do. And more the embracement of the functional impairment model, observing our patients as having a functional impairment of mobility, strength, and observing that as our marker of their impairment, but now also incorporating that into the actual treatment itself, and then returning back to that as our test and then our retest as well afterwards. So it's really incorporating the functional impairment activity itself into the treatment, and that is the movement component of mobilization with movement. The other component I think that really differentiates this concept in the clinical reasoning is the full integration of the patient's response during the treatment itself. So rather than the test, intervene, retest paradigm that many schools of manual therapy would use, it's now a test, treat, test, treat, test, treat, test. You assess during the actual treatment itself. You again, of course, return back afterwards for your retest of functional gains, but it's that integration of the retest of the patient's comparable signs, their client-specific outcome measure, during the treatment itself, looking for symptom abolition during treatment. That way you know if you have the technique applied properly or not by their symptomatic response of pain abolition and functional improvement at the same time.
Absolutely. And how do you foresee our profession in the next 10 years, let's say? I was shooting for 20 years this morning with Julie Whitman, but then we said, I think we're moving at a fast pace. So how do you foresee this in terms of globalization?
Well, first of all, I think physiotherapy has been for myself a wonderful career. I've had now 33 years in the profession, and I can literally say I wake up on Monday morning and I get to go to work. I don't have to go to work. I get to go to work. So certainly it's been a wonderful past for myself and for many clinicians as well. I think even more so into the future as we realize several factors. First of all, the aging baby boomers and their needs for continuation of being functional and being active in their lifestyle, and they're going to be relying on our practitioners more and more to be delivering them services to be able to maintain their function and be able to be actively engaged in society. So that's the first thing, is there's a large demographic of individuals that can benefit from our skill set. I think also the major growth area in orthopedic manual therapy and physiotherapy overall is really the development of what might be thought of as the physiotherapy practitioner. We're seeing more and more development of physiotherapists of being frontline delivery of service delivery of musculoskeletal health care, and really taking on the role of what might be called the physio practitioner in the same way as a nurse practitioner. In Canada, where I live in practice, we now have several provinces that now allow radiography by request by a physiotherapist without a physician's referral. We're seeing development in several countries where, such as Great Britain, where physiotherapists can order now laboratory testing as appropriate. And now, most recently, very exciting, is physiotherapists' ability to prescribe independently within their scope of practice. So I think the future is very bright for physiotherapy, not just more techniques of manipulation, but really that development of becoming the society's primary care delivery agent of musculoskeletal health care, and working in hand with our medical colleagues to do so. That's how I see the future. It's going to be a great one over the next 10, 20, and 30 years for sure.